Okay, now. Okay,
Yes.
So I have only a few questions which are, I believe, critically important for people in Poland to understand. In what pressure you have, you are living in Kiev, in what pressure you are working with your patients. So please tell me how the situation looks like now in Kiev concerning the bombing alarm, concerning the way when you are at the patients and you need to stop the treating, and with your patients you need to go to the dedicated places which are safe against the bomb. So please tell me a little bit, because I believe that then people in Poland and many countries might understand how it is to work, to stay in your hospital during the war, because it is something that we all thought that it was the Second World War and it will never happen again, right?
I am also did not understand how it's happened, but first of all, dear Maciej, I must and want to thank you and all Polish people for great help for all of us and provide to Ukrainian refugees. Because during this time, during this more than 1 month, more than 3 million people from Ukraine refused abroad, and more than 2 million, the more part of these people refused to Poland. And now Poland is a biggest help for our refugees. If we understand that is a very big economic maybe problem for Poland, but we cordially thanks for your help, for your warm people which help our mothers, our children's, and all of these maybe old people who comes to Poland. It's a first of all many thanks, and we never forget it. We never forget it. And then maybe all the world a little tired from Ukrainian problem, the Orange Revolutions and revolution of 14. Then now it's understanding the war in 21st century is not understanding for me also. Every morning I wake up with the things, maybe it's a dream and it's not happened in really, but it's really. The Russia military forces bombed Ukraine and now Kiev more slowly, but every day we have from 5 to 10 Syrians and go to they're down to serve our lives from these military forces. It's unreally for me also, but it's our life every day. Then I never wanted to leave from Ukraine. I stayed with my colleague in Kiev. Some also refused, but most of our doctors stay in Kiev with our patients. And now we need to provide all cardiologic helps for these patients, because ischemic heart disease and hypertension and dyslipidemia did not disappear. And also hypothyroidism and also diabetes, it's also the problem for every day for us. I send you the list of drugs which we need. I did not repeat it now, you know this, and I ask best for us is it will be drugs than money, but if possible only money. We also have euro and dollar amount, if it more possible for you. Now I understand that maybe our Minister of Health provide more help for surgical clinic, because many our people need surgical help, surgical care, but acute cardiac care also must provide it for people who stay in Kyiv, who stay in our near boards. I think that we must ask more the antihypertensive, hypolipidemic drugs, anti-diabetic drugs, also L-thyroxine, because Ukraine is a problem of hypothyroidism after Chernobyl accident. It's more and more people with hypothyroidism, near 30% of all amount, mainly in women. It's that's all. I once more thanks for you, thanks for our Polish colleagues, for all Polish people, because it's big help for us, for all our people, for refugees from Ukraine. Thank you very much.
Thank you so much. But I believe that you are our heroes, because we living in Poland. When I discuss it with my children, for example, with my wife, with my family, with my colleagues, it is for me and for them. It is very difficult to even imagine how it should look like to work in the hospital when they are bombing alarm, when you have the awareness that the Russian army is near the town, and there is a risk that you may die in every moment, in fact, and your patients may die. But if you allow me, can you please tell me, because you've mentioned in one of our correspondence via Facebook, that you predict that about 30% of patients left in Kyiv, about 70% simply escaped.
No. Half of the half.
Okay, so half of them.
Half of our people stay in Kyiv, and now some of their return from the west of Ukrainian and other countries, because they are going to other countries also, to Baltic countries.
Because I also heard that from looking for the transmission in the TV on the situation in Ukraine, that many people that are escaping from Kherson, from Kharkiv, in fact stayed in Kyiv, because they consider that it is a little bit more safer than their towns, which are almost completely damaged. And that is why, okay, so 50% of patients you have in comparison to the situation
in Kyiv, yes. And all population is 40 million, and near more than 3 million left abroad.
Okay, but in your clinic, you also can see that there is about twice less patients than before the war. So you've mentioned that before the war you had about 900 patients per month, and now you have about 400, right? It is the true, right?
Yes. Near half of patients, sometimes 30%, 50%, time to time.
And have you noticed also that something changed concerning the women and men, because most of the women probably left the Kyiv, and you can see that there are more men, for example, in your departments, or there is not such a difference?
No difference. As for my clinic, my department now, maybe yes, men more, 3 men for 1 woman. Yes.
Okay, so because I wanted people that would see our interview to better understand this dramatic situation. What will happen if there is a bombing alarm during your work with your patients? Is there any standard procedure that all the patients go to the more to safer places of the institutes, or how it look like, because we would like to understand this dramatic situation as well.
Ordinarily, our patients stay in clinic, but when we hear the siren from bombing, we must introduce our patient into the down place underground to save their life. But
so it is
sometimes going, but sometimes don't go.
Okay.
Not every time. Every situation is become ordinary, and we more philosophic.
Okay. So sometimes you need simply to treat those patients in this in downtown when there is a safer place during the bombing alarms, right?
It's not a lot of time we stay there. Maybe half of hour, maybe 1 or 2 hours during the day. Not all time. Not all time. The most of time we stay in our clinic on our floor.
And Olena, once again, the drug supply you would like to have. You've mentioned about the antihypertensive drugs, hypolipidemic drugs, so statins, ezetimibe. You've mentioned about anti-diabetic drugs, especially probably metformin, right? Anti-diabetic drugs. What about antibiotics? What about anti-pain drugs or analgesic
Yes,
drugs?
I wrote you about this because all of this amount we need. I don't say that we have nothing. No, we have, but sometimes we must ask patients to go to pharmacy, and not to some patients, but relatives of these patients, going to buy some drugs for help, because we don't have a sufficient amount of these drugs all the time. Because maybe main idea of our Minister of Health now help to the people which need surgical care after bombing, after acute military forces.
Okay, and do you have also in your clinics the patients after acute coronary syndrome that require also patients that require antiplatelets, antithrombotic drugs, which are life-threatening, in fact, life-saving drugs after the angioplasty. So I believe it is also something that you need, right? Because they are very specific drugs.
We need this because also all departments are worked. Our acute care department by Professor Parkhomenko, and my department is dyslipidemia department, and I have chronic disease, family hypercholesterolemia, as you know, and also patients with endocrine disease. I must help them. I never mind about lose my patients and go another place. Never mind about this.
Olena, okay, so I don't want to prolong it any longer, because I know that you have just returned from your work, from your patients, and you have now just a few seconds to have a rest, especially that it may happen that another sirens may appear. First of all, I wish you and your relatives and families and patients all the best in this dramatic situation. So please take care and be safe. And please also be sure that in Poland here, and I guess not only in Poland, we try our best to support you and help you, because myself and my colleagues really treat you as heroes, because for me you are heroes, and I'm very sure that if we may help, it is something that we should do all for Ukraine. So best wishes to all of you. Please stay safe. Slava Ukrainie.
Thank you.
Let's be in touch. Okay.
Thank you. whenever for God, for your help, for help of all Poland people. It's very pleasure for us. It's very big help for all our reviews, for all our people, and now it will be help for our patients. I think that all of people in the world dream about victory in this war and end of this war. And I only say Slava Ukraina, Slava Polsha, glory for Ukraine, glory for Poland, and thank you very much. Thank you very much.
Thank you so much.
Thank
you so much.
Thank you.